All right, everybody. So we're going to talk about the Cencora data breach, and let's get going. So the Cencora data breach, February 27th, 2024, Cencora filed an SEC 8K form indicating there was a data breach on their organization which involved unauthorized access and exfiltration of data that included first, last name, social security number, medical diagnosis, and prescription medication information. Cencora is formerly known as the AmerisourceBergen company. It's in about 50 countries. It employs about 46,000 people. They're currently indicating that about 540,000 patients were notified of the breach. There are multiple companies that use Cencora's services, so those patients are from those companies. And so we have AbbVie, Acadia, Bayer, Genentech, Insight, Novartis, Regeneron, Sumitomo. So these are some of the companies, not all of them. So Cencora concluded their internal investigation April 10th. The actual breach, I think they noticed in February, like February 27th. So February, March, April. So after 2 months of internal investigation, they concluded their concluded their work. All right. So anyway, so there's not a lot going on. There's not a lot of reports outside of some of the basic information, but they concluded it. And a press release also was provided by the Lash Group, which is a division of Cencora, and it provided just what we said, the basic information about the data breach, and they reiterated that there was no evidence of any information being disclosed publicly or used fraudulently. The Lash Group also goes on to offer 2 years of free identity protection and credit monitoring, and then they list recommendations that you, as a possible victim, can do to better protect yourself. Okay, there are a few reports that indicate that a ransom group called Loren is taking credit for the breach, but that's unsubstantiated. So let's go over Loren's real quick, though. So Loren's is known as a double extortion group. They steal your data, they load it on their servers, they encrypt the data that's on your servers, and then they threaten to expose it if you do not pay the ransom. They were first observed around 2021, and they are known to target healthcare. Cencora is formerly known as AmerisourceBergen. We'd mentioned that earlier. This is an organization that provides services that connect companies and access to various servers, sort of like an intermediary. Their website states that they partner with pharmaceutical companies and healthcare providers to facilitate access to the therapies people and animals need. They say that they support the entire continuum of healthcare. All right, so again, double extortion. This is when data is stolen. It's downloaded and stored on the bad guys' servers. Then the company's data is encrypted on the company's devices, and then that company is extorted. The threat becomes more stressful because the data can be disclosed. It can be disclosed if you pay the ransomware, and it can also be disclosed if you don't, because they have your data and it's not encrypted. So what is an IOC? It's an incident of compromise. It's basically evidence of a breach, like traffic anomalies, multiple or unusual sign-in attempts, things that are not part of the normal behavior on your network. Who is the Lash Group? It's a division of Cencora. This division specializes in providing support services and is a group that released one of the press releases about this breach. And then this is where I would say that this definition of what the Lash Group and what Cencora provide is an example of a supply chain attack. They were attacked. The companies they support are the victims, and the patients of those companies are the victims. Who is Loren's? It's a ransom group. It's unsubstantiated that they may have been involved in the breach. This group was first observed around 2021. They are known as a double extortion group, which we had mentioned earlier, and they have been known to target the healthcare industry. What is an SEC Form 8K? So it's known as the current report. It's used to report material events. If there is a material event, an organization has 4 days to disclose that information. This is used to help provide investors with timely information of significant events. So this is something that investors want to know. This particular incident was filed under 1.05, which means it was determined to be material. Had it not been deemed material, it may have been disclosed under the category of 8.01. You can access Cencora's SEC filing online, and the link is in the credits. So on the bottom of this slide, we have a quick little snippet that says the SEC's cybersecurity rules describe a material incident as a matter to which there is a substantial likelihood that a reasonable investor would attach importance to it when they're making investment decisions. So what is SEC, or who is SEC? It's the Securities and Exchange Commission. The Securities and Exchange Commission is an independent federal government agency established by the Securities Exchange Act of 1934 in response to the stock market crash of 1929 and the subsequent Great Depression. Its primary mission is to protect investors, maintain fair, orderly, and efficient markets, and facilitate computer formation. I think that's computer information. Supply chain attack is an attack that originated from a partner or third-party vendor, which I think this falls under. TTPs, tactics, techniques, and procedures. These are patterns, behaviors, processes, actions, strategies used by threat actors to develop threats and engage in cyber attacks. HC3, this is the Health Sector Cybersecurity Coordination Center. It was created by the Department of Health and Human Services to aid in the protection of vital, controlled healthcare related information and to ensure that cybersecurity information sharing is coordinated across the health and public health sector. They provide many products, including the analyst note referenced earlier and that we will see in a second. So let's go ahead and go to that page. I think I still have it up. See if we can get it going. Let's zoom in a little bit. All right, so this is an analyst report by the Health Sector Cybersecurity Coordination Center, HC3. So when you look at one of these reports, there's some basic information. It gives you an executive summary. It gives you a small report about what may have occurred. And if you scroll down, it'll tell you a little bit about the organization that it's referencing. So this one specifically says that Loren's ransom demands range in the $500,000 to $700,000 range. It provides analyst comments. And so basically it says that there's not a lot known about the Loren's operators, and several of their technical indicators previously identified could be used for detection, defense, and mitigation, including file names, port numbers, and tactics. So there is some technical information in this. And then it says, furthermore, HC3 continues to see the following 4 categories of attack vectors frequently associated with ransomware operators. So that is phishing, that's compromise of known vulnerabilities, compromise of remote access technologies like VPNs and RDP, and distributed attacks, especially supply chain and managed service provider compromise. So that puts us right in this category with this group. All right, so there's more information that you can get. It basically gives you as much information as you want. You can go to Tesorian for the indicators of compromise. You can go to Bleeping Computer to learn a little bit more about this particular Loren's ransom group. There's a free decryptor and analysis of the Loren's ransomware on the Tesorian site. It's also on the No More Ransom site. This is a good site to go to, especially if you're a small business. There's usually keys and decryptors for ransomware that's out there, so pay attention to that. This company was hit with ransomware but didn't have to pay up. There's some articles about some other ones, and there's contact information. So these analyst notes are really good. You can dig through, and if you may find a lot more technical information if you like that part of it. And but it also gives you enough information where if you're not really into the technicalities or the technical information, this will also give you a little bit more information about the particular group that they are referencing or the topic. All right, so recommendations overall. If you are an actual patient or an actual individual victim, you can take Cencora up on their offer. You can take them up on the 2 years identity protection if you don't already have it from another breach. You can place a fraud alert on your credit file. You can place a security freeze on your credit file as a company or an organization if you want to reduce the likelihood of being attacked. You can make sure that you have multi-factor authentication implemented. You can use least privilege and role-based access, and definitely focus on awareness training. These are small steps that will help protect your organization, and hopefully you will not be affected by anything extreme. And here are the credits, and again, there's a lot of credits in here, databreaches.net, Bleeping Computer, quite a few, and then you'll actually see one up here from Abington Law. And what will happen with all these breaches is if you do one decent Google search, you will find at least one law firm that is offering to add you to any class action lawsuit that's related to these breaches. And here's some more sites. Bleeping Computer again. Again, Bleeping Computer is one of the best sites out there. HHS.gov. The Lash Group for their press releases. No More Ransom to help you with free keys and decryptors if they are available for some known ransom attacks. SEC, and I think that's about it. And again, one more time, Cencora data breach was it occurred in February, and there are quite a few hundreds of thousands of victims out there, and hopefully you are not one of them. And thank you for listening. See you later. Bye-bye. What the heck?